Effect of preoperative oral steroids in comparison to anti-inflammatory on anesthetic success of inferior alveolar nerve block in mandibular molars with symptomatic irreversible bulbitis. A double-blinded, randomized clinical trial by Vivek Hegde and colleagues from India, along with Sitzer from University of Pennsylvania. Failure of inferior alveolar nerve block in teeth with irreversible bulbitis is reported to range from 43 to 83% in the literature. Different approaches were tested to augment the low efficacy of the technique, including additional infiltrations, intraosseous injections, and/or oral premedications, which showed volatile efficacy in the literature. Of those, glucocorticoids such as prednisolone exert anti-inflammatory action by its anti-phospholipase activity that reduces cyclooxygenase and lipoxygenase byproducts, namely prostaglandins, whereas NSAIDs inhibit COX pathways affecting the production of prostaglandins and thromboxane A2. For the aim of this randomized clinical trial is to compare the anesthetic success of inferior alveolar nerve block with 2% lidocaine in mandibular molars with symptomatic irreversible bulbitis after oral premedication of prednisolone, dexamethasone, and ketorolac against a placebo group. For the methods, 184 patients diagnosed with symptomatic irreversible bulbitis were randomly assigned to 4 groups receiving either 10 mg ketorolac, 4 mg dexamethasone, 20 mg prednisolone, or a placebo. And for determining the success of the inferior alveolar nerve block, the root canal treatment were carried out after 2 consecutive negative electrical bulb test results, and the outcome was measured that patients showed no pain during access cavity or endodontic instrumentation. For the results, when premedicated with oral dexamethasone, ketorolac, prednisolone, and the placebo, the success rates of inferior alveolar nerve block was determined to be 60%, 65% for the ketorolac group, 56% for the prednisolone, and only a 21% in the placebo group. For the conclusion, preoperative use of oral ketorolac, dexamethasone, or prednisolone may increase the anesthetic efficacy of inferior alveolar nerve block in mandibular molars with symptomatic irreversible bulbitis.